Good day, I am Aldrin Havaliano, and this is the CHN scale thermometer technique. So the thermometer technique is a method of checking a client's temperature with due attention to the cleanliness of the thermometer that is being used. So there are three purposes of this procedure. Number one is to check a client's temperature and discover any significant findings. Number two, to keep the thermometer aseptically clean so as to prevent the transfer of infection from one client to another. And then third is to protect the other contents of the bag by keeping the thermometer aseptically clean. So in this procedure, you will need a thermometer, obviously. So there are types of thermometer. There are four. Number one is the digital or the electronic thermometer. Number two is a chemical disposable thermometer. Third is a temperature sensitive tape. And fourth is an infrared thermometer. And also there are sites for measuring the body temperature. There is oral, rectal, and axillary. So to start off the procedure, you must greet the client or the responsible family member and introduce yourself. This is to prepare the client and relieve anxiety. So for example, good morning, Mrs. Reyes. I am Aldrin Havaliano, and I am a student nurse from MSU IIT, and I am here to check on your body temperature. So also state and explain the purpose of the visit, also to prepare the client and relieve anxiety. Then after that, proceed to donning a gown. So a gown should cover you from the neck to your trunk as well as the full length of your arms, just like this. Then the opening of the gown should always be in the back. So this is to prevent soiling or to protect the clothing of the healthcare provider from any contamination from bodily fluids. And then wash your hands. So assuming I'm already done with the hand washing, this is to prevent the infection from the healthcare provider to the client. So now, using the bag technique layout, put out the thermometer and leave the case inside the bag. This is to prevent the contamination of the case of the thermometer. Now next, we're gonna explain what we are going or planning to do. So this is to relieve the anxiety of the client and also adjust your explanation to the client's needs. So if using a mercury thermometer, remove the thermometer from its package and check the temperature reading on the thermometer. So if necessary, you need to shake down the thermometer. So assuming this is a mercury thermometer, and this is the bulb. So you need to shake down the thermometer or the mercury by holding the thermometer between your thumb and forefinger at the end farthest rather from the bulb. So assuming this is the bulb, so this is the farthest end. Then sharply snap your wrist downward. So repeat that until the mercury is below 35 degrees Celsius. So this is for accuracy of the findings. Then if you're using an electronic thermometer, gather the kit and disposable probe covers, then attach the probe to the unit, being sure that you attach it to the appropriate circuit. So next is place a cover on the probe and then warm up the machine by switching it on if not kept on. So with my electronic thermometer, what I'm going to do is just press this button to turn it on. Right. So this is also for the accuracy of reading of the temperature. So for oral temperature, first determine the time the client last took a hot or cold food or fluids or smoked. So this is to obtain an accurate oral temperature, because hot or cold food ingested by the client can alter or give false results or reading in body temperature. So to obtain an accurate oral temperature reading, it is recommended that nurses allow at least 15 minutes clasping between a client's intake or smoking and the measurement. Next is to place the thermometer or probe at the base of the tongue to the right or to the left of the frenulum or the posterior sublingual pocket. So this is because when the probe rests deep into the posterior sublingual pocket, it is in contact with blood vessels. And then next is to ask the client, so assuming that you're already, or the probe is already in contact with the appropriate site or area, what you're going to do next is to ask the client to close the lips but not the teeth around the thermometer. So it is also necessary that you support the thermometer by holding it in place, because if left unsupported, the weight of the probe tends to pull it away from the correct position, thus may give you a false reading. So for the rectal temperature, so what you need to do is first place some lubricant on a piece of tissue, assuming this is a lubricant. Then apply the lubricant to the thermometer about 2.5 centimeters above the bulb. So this is because lubrication reduces friction and facilitates insertion, which minimizes the risk of irritation or injuring the rectal mucous membranes. And the next step is to don a disposable glove on your dominant hand. So once you're done with that, with your non-dominant hand, raise the client's upper buttock to expose the anus. And then, once you're done with that, ask the client to take a deep breath and then slowly insert the thermometer into the anus anywhere from 1.5 to 4 centimeters, depending on the age and size of the client. So the depth of insertion must be adjusted based on the patient's age. And then also taking a deep breath often relaxes the external sphincter muscle, which eases insertion. So remember, do not force insertion of the thermometer, because forcing the probe into the rectum may create discomfort to the client. So hold the thermometer in place for 2 minutes, or as recommended by agency policy. For an axillary temperature, place the thermometer in the client's axilla and assist the client to place the arm across the chest to keep the thermometer in place. And leave it on until it beeps, because proper positioning maintains the correct reading of the thermometer against the blood vessels of the axilla. So if your patient or your client is irrational or very young, it is essential that you remain with him or her and hold the thermometer in place. And when you're done, remove the thermometer and wipe the thermometer with a tissue. Start at the end, held by you, and wipe in a rotating manner towards the bulb. Now discard the tissue in a receptacle used for contaminated items. So the manner of cleaning the thermometer should start from the cleanest to the dirtiest part to not spread the microorganisms in the thermometer. Then read the temperature by holding it at eye level and rotate until the mercury column if you're using a mercury thermometer, is clearly visible, then inform the client of the reading. So the manner of um, reading, which says to read it on eye level, so this is to ensure the accuracy of the reading. So wash the thermometer after that in a tepid soapy water. And also organic materials such as mucus must be removed before the thermometer is stored. This is to prevent the spread of microorganisms. Then after washing it, rinse it in cold water and dry it, and then store. Cold water and drying the thermometer makes it ready for the next use. And then lastly, shake down the thermometer and return to its container, or discard it if it's disposable. If the thermometer is to be disinfected before storage, then use 70% ethyl alcohol. So this prevents the transmission of microorganisms. And before you leave, wash your hands and record the temperature in jot down notebook or vital signs flow sheet. And also report abnormal findings, and if the temperature is abnormal, then repeat the procedure. So this is for accurate documentation by site, allows for comparison of data. So before you leave the home just yet, wash your hands first and record the temperature on a jot down notebook or a vital sign flow sheet. And also report abnormal findings, and if temperature is abnormal, repeat it, because accurate documentation rather by site allows for comparison of data.